Good morning, this is Dr. Karthic Natarajan. I am an interventional spine and pain physician from the Synapse Pain and Spine Clinic in Besant Nagar, Adayar, Chennai, India. Today we are going to be talking about tailbone pain or coccydynia. Now, sometimes we get patients who get pain in the lowermost bone in the human spine, which is called coccyx. So patients who are having pain in the tailbone have coccydynia. Now this may have been caused by a fall, or this may have been caused by a repetitive action like traveling in a two-wheeler without any shock absorber or traveling in a really bad road. Now this happens because there is some inflammation around the last bone, which is called the coccyx. Now, whenever you find patients with coccyx pain, the first thing the doctor may ask you to do is to confirm the diagnosis. So, these patients have pain in the tailbone and in the gluteal region. This pain may become more when they pass motion sometimes. So, we confirm the diagnosis by getting a side X-ray, which is the pelvis lateral view X-ray. Sometimes you will find the coccyx bone is looking normal in the X-ray. Sometimes you will find the bone is curved more. Sometimes you may find dislocation or fracture in the coccyx bone. So coccyx pain or coccydynia is not a dangerous condition. So what we do is we treat these patients conservatively first, which includes some lifestyle changes. So obviously we don't want you to travel in something that is very jerky. So preferably we encourage patients to use cars or bus or train, something with minimum jerk instead of two-wheelers and autos. Second is, once the coccyx diagnosis is confirmed, we encourage patients to use what is called a coccyx cushion. Now coccyx cushion is like any other cushion which you have to put on the chair in which you are working or on your dining table or sofa. This cushion comes with an inherent hole exactly where the coccyx is located. So when the weight is getting transmitted, the coccyx need not participate in the weight transmission. So the weight is going more towards the gluteal muscles. So coccyx cushion is something that doctors may advise if you have coccydynia. Along with this, the lifestyle changes and the coccyx cushion, we may also give some medication, which could include some anti-inflammatory medication to reduce the inflammation around the coccyx. Now, majority of patients with conservative treatment should become better with coccydynia. Now, there are a small group of patients, maybe 20-30% of patients, who have persistent coccygeal pain in spite of using coccyx cushion, in spite of following the lifestyle changes, in spite of taking the medication. In those group of patients, we do some basic interventional pain procedures which are called coccyx injections. So what we do is we take this patient to the procedure room, make them lie down prone, and we see under the X-ray how the coccyx bone is, and after giving local anesthesia, we do an injection around the coccyx nerve. The purpose of the injection is to reduce the inflammation around the coccyx bone. There is a really small group of patients who also have what we call as a subluxated or a dislocated coccyx. So in this group of patients, the coccyx is turned, and this can cause coccygeal pain. So if you are one of those patients where the coccyx is subluxated or dislocated, along with the coccygeal injection, your pain physician or orthopedic surgeon may also offer what is called as a coccygeal manipulation. So coccygeal manipulation is a very simple procedure where we give anesthesia and we straighten the bone that is curved. So this is coccyx manipulation. Along with that, we also do the coccygeal injection. Now, patients who are refractory, nothing has happened. The coccyx manipulation plus pericoccygeal injection is a safe and effective and definitive treatment for coccygeal pain. Coccyx is a very easy condition to treat for pain physicians and orthopedic surgeons. So if you're having coccygeal pain and if you have not come around with basic treatment, you can consider the safe interventional pain procedures. Thank you.